good evening, everyone. We're going to wait a couple of minutes for people to join us, and we invite you to share the link to this webinar on your social media and with your network and friends so they can join, even if they didn't register. And we'll start in about a minute. We're glad you've joined us today. So if you're just coming online now, we will be starting shortly. Just waiting for a few more people to have a chance to get on the link. And we're delighted you're with us today. While we're waiting for everyone to get logged on, we do invite you to put your name in the chat so we can see who's here, your name or your organization, and maybe a little bit about why you're interested in this topic or why you signed up for this webinar. We invite you to put that in the chat so we have a chance to meet each other that way. Okay, for those of you who are just signing on now, welcome. We're going to move ahead and start by welcoming you to what is the fourth part of a webinar series that's been called Looking Back to Look Forward, COVID-19 and Faith Reflections on 2021. So looking at 2 years of our experience in this pandemic. You can watch the previous webinars on the link that will be posted in the chat. And the webinar started taking place on March 1st. And this will be the final in this series, the final webinar in this series. The series has been co-sponsored by the Joint Learning Initiative, the World Faiths Development Dialogue, and the Berkley Center for Religion, Peace and World Affairs at Georgetown University. We've posted the link to the reports and the recordings in the chat box. And we also want to acknowledge that this event is also being co-hosted with the support of KAICIID. It's just a partner to the JLI's Fair and Equitable Dialogue series. To get started, let me just go over some technical information. The discussion will be in English, but we do offer simultaneous interpretation to Arabic, French, and Spanish. In order to listen to the interpretation, please choose the interpretation button at the bottom of the screen and then pick your desired language. If you wish, you can mute the audio, the original audio from the speakers as they're speaking, so you don't hear the background of voices. If you somehow lose the connection to the event, just repeat the steps above in order to be able to listen to the interpretation. And once again, please do introduce yourself in the chat. Let us know where you're coming from, where are you, your organization, and maybe a point about why you joined us today. This call is being recorded, so if you wish to watch the webinar recording or share it with others, it'll be available on our websites as well as KAICIID's YouTube channel. We invite you to write your comments and questions in the chat and put all the questions for the speakers in the Q&A box specifically. You will find at the bottom of your screen, and we'll be selecting the questions after the discussion. And we also invite you to share your thoughts on social media. Zainab will be posting the hashtag and links for Twitter in the chat box. So as I mentioned before, this is the final in a series of webinars and let me just tell you that the JLI's Fair and Equitable Dialogue series, this is the final in this COVID series, but in general, this webinar series is designed to be interactive public events that examine how faith actors can challenge power dynamics in the international humanitarian and development sector. We specifically like to speak to context. We look at this webinar series to help us clarify some of the terminology that's often used that can be confusing or contested, words like decolonization, localization. And we use this webinar series to really look at the history and the context behind international and local faith partnerships. One of the reasons why this COVID series is so important is because, as we all know, COVID really shone the spotlight on some of the needs to increasingly shift how we center people who are working on the ground in the decision-making, the resources, and the leadership of our responses. So we see this as a kind of a critical discussion and a dialogue series. It will be continuing. This particular 4-part series will be finishing, but we will have more events coming up. So please continue to join us. So we have speakers from a wide section of places around the world who will be sharing their experiences from their work in Sri Lanka, the Philippines, Egypt, UK, Zimbabwe, and elsewhere. And they'll be focusing on the emphasizing the opportunities that they have had to work from a particular context, and as well as the challenges that they, have observed during the response to the pandemic and its implications. The specific webinar that we're having today is going to be looking at the implication of COVID-19 on women's rights, mental health, livelihoods, misinformation, peace building, and beyond. These are topics that are very specifically addressed from the experience of our speakers. So just to introduce myself, I'm Kirsten Larsen Muth. I'm the CEO of the Joint Learning Initiative. I've joined in literally at the onset of this in June 2020, sort of joining right as the COVID pandemic was really ramping up. So for me, this webinar series is particularly important as I, learn to navigate this organization within the context of COVID. So it's really a great time to take a moment to just look back and how all of this has shifted our lives. So I'm really excited about the speakers that we have today. Each one is speaking from a very specific context, a very specific set of experiences. And they will be sharing sort of an overview of how they have seen faith engagement happen during COVID, specifically from local contexts, and how really inspiring work can happen within those specific contexts. We like to call this a canvas of experience, sort of a tapestry of experience, and we will sort of conclude the webinar with having each speaker make a main point that they'd like us to really think about as we end the webinar. So let me just briefly tell you who our speakers are. As we introduce them throughout the webinar, I will be giving some brief introduction to who they are, but they have so much more background. So we'll be posting more about them in the chat as well. So our speakers today are Professor Ezra Chitondo, who is the Professor of Religious Studies at the University of Zimbabwe, and I'm proud to say also a JLI board member. Mrs. Monica Todros, the Director of Programs and Projects Department at Muth for Peace, Development, and Human Rights, which is in Egypt. Professor Kalinga Tudor Silva, Professor Emeritus of Sociology at the University of Peradeniya in Sri Lanka. Brother Ronaldo Bernido, the Executive Director of Duyag Marawi in the Philippines, and Dr. Binar Talibani, a kidney and transplant doctor and immunology scientist at the UK, which is what her main thing is, but she also does some incredible other work, and you'll be hearing about that as well. So as I mentioned, their full bios will be presented in the chat box. So we're going to start today with listening to a few keynote words from Professor Ezra Chitondo, who will be speaking to us for about 4 minutes on the theme of today's dialogue. Professor Chitando serves as the Southern African Regional Coordinator for the Ecumenical HIV and AIDS Initiatives and Advocacy, a program of the World Council of Churches. He is a professor of religious studies at the University of Zimbabwe. He is also an extraordinary professor at the Desmond Tutu Center for Religion and Social Justice at the University of Western Cape, South Africa. You'll learn more about him in the chat, but Professor Ezra, may I welcome you to address us. Thank you so much.
Thank you very much, Kirsten. Good afternoon, colleagues. It is my singular honor and privilege to talk to us this afternoon. So listening to the stories of local faith actors on the COVID-19 response, I'm drawn to think of a chameleon. A chameleon is a very small creature with unique qualities. But one of the most important qualities that I admire is the distinction that the chameleon's eyes have. It is the only creature whose eyes are able to look in different directions at once. One eye looking backwards and another one looking ahead at exactly the same time. And this is the challenge before us in the HIV context and COVID-19. What is it that we learn from the past that allows us to understand the present and prepares us to move into the future? Allow me to highlight a few of the responses that faith communities have demonstrated within the Southern African region. I will draw attention to these because faith actors are critical. Critical in terms of the membership that they enjoy globally. Over 80% of humans on this planet profess one religion or the other. In fact, it's upward of 80%. And so how did faith actors respond to COVID-19? I will highlight a few of these. For example, number one, during the pandemic, faith actors in Southern Africa have been first-line responders, but doing what? Disseminating valuable, life-giving information, delivering life packs, food packs to vulnerable families, exercising what I've called here an online ministry of presence at a time when most citizens were lonely and frightened. Faith communities were present in the trenches, even during the heavy lockdowns, providing and accompanying the infected, the sick, the dying, and the bereaved. This, of course, generated serious mental health challenges, and colleagues on this call will share. And so faith communities were again called upon to accompany, to be present to those who were experiencing serious mental health challenges. I will draw attention to one example in South Africa relating to the impact of the faith community in terms of advocacy in the light of COVID-19 funds. Across the world, in many parts, COVID-19 funds were mostly abused by those in positions of power and authority. And the South African Council of Churches said, and I want to quote, "These so-called COVIDpreneurs have shown that evil culture of greed and corruption triumphs over honesty, ethics, and good governance," end of quote. So there was a lot of activism by faith communities to call governments to order. It strikes me, friends, on this call that there was also concerted interfaith action among faith actors in the face of COVID-19, a realization that COVID-19 did not choose which faith to attack and which faith to preserve. In other words, there is no variant which is there for the Christians, for the Muslims, for the Hindus, but one COVID-19 pandemic which had to be addressed jointly. Let me draw attention to two key issues as I conclude. Number one, the sterling, exceptional work done by women in faith communities. Friends, where would faith communities be without the sacrifice and leadership of women? Secondly, some problematic responses by faith communities to COVID-19. I'm hoping colleagues on the call will draw attention to this. So even as we in the faith communities achieved a lot, there were some problematic dimensions that needed to be and still need to be addressed. In conclusion, this webinar calls upon us to summon the unique qualities of the chameleon. We must look backwards and look forward at exactly the same time. I thank you and over.
Thank you so much, Professor Ezra. The image of the chameleon is a really powerful visualization of, and I think it's an excellent way to frame this conversation that we're having today. And thank you so much for mentioning the different dimensions, I think some of which our speakers will be talking about, and highlighting the role of women and how they responded, women faith leaders, women faith networks, and how they responded in the crisis, and yet how women have also been so have been so negatively affected, as we've seen increased violence against women during the pandemic. Also, your example of the South African Council of Churches in speaking up and challenging some of the corruption that was going on with the COVID funding, and the problematization of faith within the COVID response, which is a specific question we'll be dealing with later on in this discussion as well. We'll be having 3 discussion questions and then ending with a Q&A. So we have what we like to do. We like to make our webinars as interactive as possible. So we're going to start, before we move into our speakers, hearing from our speakers, we want to unpack the question of how local faith actors are sometimes blamed and how different behaviors that we've seen can either control or perpetuate the spread of the pandemic. So we're going to share a link to the interactive poll in the chat, and there's also a QR code on the screen. You can use your phone to scan the code or use the link. I'm giving you a second to do that. There's 2 questions for this poll. So the first question is, since the outbreak of the pandemic, local faith actors have played key and essential roles in controlling its spread and social implications. Do you agree or disagree? Okay, strong agreement, some disagreement. And it would be interesting to know, were we to discuss this from the disagreement, is that coming from the perspective that they could have played bigger roles if given more agency, or resources or leadership? Always interesting to unpack these questions. Something to think about. The second question, how have you seen local faith actors behave or take action in the pandemic? And this is a pretty open-ended question. So what are some of your observations? What are some of the things that you might want to mention about how faith actors responding on the ground within specific contexts? What are some of the actions and behaviors that you've seen? Sort of a mix. We're seeing a sort of a mix of positive and less positive. A lot of service delivery, a lot of on the ground response. Also the holistic, wow, that's a lot of screen there. Misinformation, prayer. Trying to maintain respect for, trying to navigate the COVID restrictions with traditional practices and the way we practice our belief. Pivoting to using technology for connectivity. Some of the debates we've seen were challenges between religion and science. And I know that, for example, Religions for Peace did a whole event on this, religion and science. So there's a lot of things that have been really unpacked in this pandemic that are really important as we move forward. Emotional care, pastoral care, prayer. Great, well, all of these will be in the report and we appreciate you participating in the poll. So now we're going to move to hearing from our speakers. So one of the reasons why we started off with this poll is that we all are well aware that local faith actors are by and large always our first line responders, but they can sometimes, and we see this in the media a lot, can be blamed for things that are going wrong. And some of that can be misinformation, resistant to some of the messages about COVID that are coming from the medical and health professionals. And a lot of these have history and context behind how people perceive some of these things. So as a result, sometimes faith actors are accused of perpetuating the pandemic. So what we'd like to have the next part of this first part of this three-part conversation focus on is, can you tell us, our speakers, about your on-the-ground experience and your context, from your specific context, about how you saw faith actors dealing with the different behaviors and beliefs around the pandemic. So I invite you to share some of your work, either as researchers, practitioners, doctors, or local faith actors within your context. And I invite you to share reflections on how you saw these behaviors and beliefs being addressed. Each speaker will have about 4 minutes and we're to address this question. And we're first going to hear from Professor Tudor, who is a professor emeritus of sociology at the University of Peradeniya, Sri Lanka. He's also currently the chief editor of the Sri Lanka Journal of Social Sciences, published by the National Science Foundation of Sri Lanka. He's the author of Decolonization, Development, and Disease, A Social History of Malaria in Sri Lanka, which was published in 2014. His full bio will be in the chat. And Professor Tudor, I welcome you to give us some comments here.
Thank you, Kirsten. Let me first give a quick background about Sri Lanka. Sri Lanka is an island nation with a population of about 22 million people. Sri Lanka is a multi-ethnic and multi-religious country, and roughly about 70% of the population belongs to Theravada Buddhism. Another 13% are Hindus. Muslims constitute about 10%. And there are two groups of Christians, Roman Catholics and other Christians. They make up about 6% of the population. So this is the kind of demographic profile of the population. Because the Theravada Buddhist are the majority in the country. Historically, they have been like in power, meaning holding political power. There has been kind of coexistence among different communities over the long period of time, also interacting with each other peacefully. But there have also been occasions of conflict, confrontation. Particularly the Buddhists believe that, Sri Lanka is their country because they are the majority, and this is sometimes referred to as Buddhist exceptionalism. And they have a special provision in the Sri Lankan constitution, but it doesn't mean that minorities are, treated differently. So in recent times, there have been some tension between the majority Buddhist and other communities, and I will talk about it in more detail later. And with regard to the pandemic, actually pandemic led to responses from all these different groups, mostly positive responses in terms of providing relief, providing humanitarian assistance, and also providing emotional support for the affected people. And also, I think one of the key points I want to highlight in my presentation is that, COVID-19 was initially like a source of tension among communities, with some communities being blamed for being super spreaders of the disease. But over time, as the disease progressed, people identified it as a common problem that has to be addressed collectively by all people, and that led to a lot of interfaith activities, including humanitarian assistance crossing ethno-religious boundaries. So that was a positive impact. I think with that, I will stop this particular part of my intervention.
Thank you so much, Professor Tudor, and thank you to the speakers for staying within the time parameters. We have a really jammed schedule here. Our next speaker is, so I appreciate that in your comments. Our next speaker is Mrs. Monica Todros, who's the Director of Programs and Projects Department at Muth for Peace, Development, and Human Rights. Previously, she was also the head of communication department with UN Special Procedures. Monica is a youth worker who is mainly active in peace building and youth empowerment. She holds a bachelor's degree in political science from Cairo University. And again, her full bio will be in the chat. Monica, welcome.
Thank you, Kirsten, and welcome everybody, and thank you for your attendance today and joining us. First, I will speak about the local context of Egypt at that time so we can understand and reflect, as well as measuring how the local faith actors have been responsive for the implications of COVID-19. So in Egypt, during the COVID-19 pandemic, it's turned into a stigma. So it's not a health issue at that time, as much as it was a social stigma. All those affected attempts to keep it as a secret, refrain from going to the hospital, and those who perceived a link with the pandemic have endured verbal and physical assaults, so as well as social and institutional exclusion. Due to the refrain and delay of reporting COVID-19 infections at the time, and which was the middle of the first wave, and we can imagine how it was the situation then. So the Egyptian Health Ministry recorded higher death rate. Around 30% of the deceased died outside of hospitals. Such behaviors, both the vulnerable people as older people and those with chronic illness, are at greater risk and put a new burden on the health system on the government. Hence, people are more likely to be labeled, stereotyped, discriminated against, and falsely blamed for the spreading the virus due to the false information and rumors. And here we come to the role of local faith actors, how they can respond and how they can be a partners and address the stigmatization and discrimination, which had a negatively impact to the peaceful coexistence in Egyptian community at that time. So from here we come the idea behind our project, which named the human solidarity, promoting human solidarity through the interreligious dialogue during COVID-19. So the local faith actors were active in their communities, responsive to the needs, and we believe that they become partners who should be involved with other stakeholders and policymakers to comfort COVID-19 implications. So we focused on the raising awareness after we had a training program for the participated and targeted local faith actors, so they can work on raising awareness on the hygiene measures, on the right information and health information related to vaccination. And also we worked on supporting and spiritual support and how we can send optimistic messages to the people and support them and not to be afraid, and how they can comfort as also any stigmatizations that they can face at that times through many different technological and digital spaces. And also launching counter-narrative campaigns that led by local faith actors against hate speech and false stereotypes that related to COVID-19, ensuring empathy and unity by encouraging the faith communities to help others and assist the vulnerable, either the elderly or people with disabilities or vulnerable neighbors which facing some restrictions on their daily life because of COVID-19 at that time. So maybe later we can speak in details about the outcomes of the work of the local faith actors in these fields and in these themes. Thank you.
Thank you so much, Monica. Those are some excellent points. It's interesting when we talk about blaming faith actors, how much focus there is on in the media on negative and less focus on the amazing positive work. Sometimes we don't hear enough about that, so I appreciate you sharing that. Our next speaker is Brother Ronaldo Bernido, who is a humanitarian worker, development strategist, and peace builder for the past 25 years. He's the executive director at Duyag Marawi, a church-based and interfaith dialogical response to the Marawi crisis in partnership with the Redemptorist missionaries. His bio again is in the chat, and I welcome you to address us, Brother Ronaldo.
Hi, thank you, Kirsten, and good evening, everyone. I hope you can hear me clearly. Again, my name is Ronaldo. I'm a local faith actor here in Muslim Mindanao, which is the minority because the Philippines is a predominantly Christian country. Perhaps I'd like to begin where we are at this point. It is election year in the Philippines and arguably a hotly contested one. And since late last year, people gather for rallies by the hundreds of thousands, support their candidates with no social distancing whatsoever. And yet our schools, our pupils are not allowed to have face-to-face classes. Large religious gatherings are still prohibited, even if political rallies are allowed at this moment. And that is just one of the many examples of how difficult it was for us to manage information and educate local communities about the pandemic because of the inconsistency of the messaging. And that is the context of my sharing this tonight. Our local faith actors, our responses were not so much because of the actual health situation or the effect of the pandemic. Our responses were based on the impact of how our government managed the pandemic. And that's mostly restrictions, prohibitions, protocols, and the gaps that were created from the outset. In the Philippines, the hardest restrictions were implemented during the first month when there were like less than 50 cases. The military presence was real. People were arrested. A few people were killed just for breaking curfew. You are not allowed to practice our church traditions, and we have to apply for a permit to operate as humanitarian frontliners. We had to present our medical certificates. We have to go through several military checkpoints because we were not considered frontliners from the beginning. But those restrictions also push us to be creative and responding to the needs of the people, particularly in hunger, in mental health, psychosocial support, and also in terms of health education. And that's where I want to share further tonight. Thank you very much. Kirsten?
Thank you so much, Dr. Binar, and thank you for highlighting the complexity of the inconsistent messaging and the contradiction between political rallies and yet religious restrictions, education restrictions, just all of the complications that contribute to how we message the pandemic. The last person speaking to this question, but not the least, is our Dr. Binar Talibani, who arrived in the UK in 1998 as a refugee, having fled Saddam's regime. Her family were targeted for their involvement in the Kurdish resistance against Saddam Hussein's regime. She is currently completing her PhD in immunology at Cardiff University. But Binar is also one of the founding members of Muslim Doctors Camera, which was formed in 2020 to combat COVID-19 vaccine myths and misinformation. She later joined Team HALO, which is a United Nations initiative to combat misinformation, and has also volunteered with the British Society for Immunology to create science-backed content on vaccines. More information about her bio is in the chat. Dr. Binar, the floor is yours.
Hi, everyone. Thank you for inviting me to speak today. So at the beginning of 2020, when the first COVID vaccine was approved for use, I think there was a huge sigh of relief among doctors, scientific community, and I would have expected in the general public, but instead what we saw was lots of hesitation. How was a vaccine produced so quickly? Is it safe? Is it trustworthy? Is it going to help us? And I think before we as scientists had a chance to explain the science and the evidence behind it, the misinformation machine started to spread huge amounts of misinformation, causing real hesitancy and doubt and concern. And so alongside having a pandemic to deal with, we also then had an infodemic of misinformation. And what we found was that people who would normally follow the advice of their doctors and take the medications that they were given, sometimes that question, which I don't necessarily agree with, but sometimes that question, were now suddenly worried about this vaccine. And so it became really important that those of us who are trained in medicine or science or immunologists start to have those conversations to explain the science and to essentially communicate why these vaccines are safe. One of the biggest issues that we were coming across was that there was mistrust among authorities, so be that government or whatever authority that was essentially promoting the uptake of these vaccines. And what we saw in the UK, and as I'm sure we saw in other parts of the world as well, was reduced uptake, particularly among ethnic minority communities for lots of different reasons. So we created Muslim Doctors Camera with a view of taking local doctors who are from this community, the Muslim community, who are known and trusted among the community, to be able to deliver science-backed content to address this misinformation. And we did so by collaborating with the Interfaith Council, so all groups of faith had access to our information. We had webinars in different languages where we also engaged faith leaders to help people to come along and have their concerns addressed. We conducted surveys, so we would not make any assumptions about what people were worried about, but actually explore what people were worried about and then help to address them. We conducted a social media campaign, which is still ongoing, by releasing videos and content in different languages, because the misinformation was present in different languages. but the accurate information, there was a real void of it in different languages. So our webinars and social media content were always present in different languages. We also set up mosques as vaccination centers. And this work and other work that we have done since has really given us a platform so that groups like Welsh Government, central government, health boards, and other authoritative groups have now approached us to do more of the same work, not just with vaccine misinformation, but actually with lots of other campaigns, such as mental health campaigns. And that's what we're doing at the moment. Thank you.
Thank you so much, Dr. Binar. And thank you all for your comments and just the emphasis on, mistrust. Misinformation usually is a product of mistrust, and mistrust comes from somehow feeling overlooked, that somehow the concerns and the priorities of local communities have not been adequately heard. So as a product of that, that leads us into our second question, which has to do with mental health. The pandemic was confusing. The information was confusing. The messaging was confusing. The access to resources to respond was confusing. So our next question is going to be focused on mental health issues, which has surfaced as a huge area, and increasingly faith actors in terms of mental health and pastoral care. We know in our own COVID study of local faith actors that mental health, pastoral care, spiritual care was one of the primary ways that people were responding on the ground. So we are going to be addressing this question with the next round of our panel. But before we do that, we have another interactive poll. I also invite you to continue to put your questions in the Q&A box. So Zainab is going to share again how you can connect to that poll with your link or QR code. I'll give you a second to get connected to that. And then you'll be answering the question from your own experience. How have faith organizations and faith actors influenced or impacted your experience of the pandemic? Feel free to share more than one response. So I'm seeing the importance of the idea of providing comfort, providing solace during stressful times, making us more compassionate. I know in my own church, we worked on different ways to reach out to people that we knew would be very isolated in the pandemic, and making sure that there was connectivity to them. I think we still have yet to understand the full impact of the pandemic on our mental health. Okay, and then that some religious actors can be reactive versus proactive. Okay, the need to be connected to understanding how to participate, or how to be more, I think this speaks to the faith and science conversation. I know that there's been a lot of focus on that as well. Okay, great. So Appreciate all your responses. So what I'd like to do now is to just begin to invite our speakers to address the same question. How have local faith actors addressed stress and mental health during the pandemic and now? So we'll start with this round. We'll be starting with Mrs. Monica. Each speaker has about 3 or 4 minutes to address the question. Thank you.
Yeah, thank you, Kirsten. So we will come to the outcomes of the local faith actors initiatives. So they start with the support of their communities by raising awareness. So they start with the countering the misinformation related to the vaccinations. And we have like the Grand Imam of Al-Azhar, which is the biggest religious institution, Islamic institutions in Egypt and the Middle East, posted a video on Facebook, said that all acts of bullying, mockery of the victims of the coronavirus are dangerous and totally unacceptable. And the later, most of religious institutions started to promote and publicize and encourage the acceptance of the vaccination. And because there are some other voices started to be raised against the vaccination and that religiously not right and etc. So when we get an official statements from the religious leaders, and then the local faith actors started to promote that and publicize that ideas and principles in the surrounding communities and during their small circles. So we start here to have an impact like from bottom up approach. So they start to have a Facebook page, which called Prevention First. In Arabic, it names Al-Wuqaya Awalan. So they start with this Facebook page to share information about the vaccination in a simple way and a simple language that anybody can understand. And they start with the, a survey, so we can check the fears of the people from vaccination, and we start to share the right information and to respond to this fear, so we can like have a balance here in the acceptance of the vaccination. And on the other hand, on this Facebook page, they start to send optimistic messages and religious messages that support the mental health and spiritual support as well. Not only religious message, but also like some stories, books, movies, songs, by encouraging listening to the music at that time, so we can have we can reduce and limit and minimize the stress at that time, which is the pandemic caused for all of us, and not only the pandemic from the health perspective, but also from the economic and social restrictions and implications. In addition to that, they have a good and brilliant idea, but unfortunately, it doesn't happen because of some restrictions that we will talk later about in the challenges. That they created a mobile applications in which we can check some materials that provide you a support and also some information related to the food that you should eat and your health circumstances when you need urgently to go to the doctor, or what you can do, how you can show support to the people around you in the home, in the school, and in the community, and even in the religious institutions or worship, whether the mosques or the churches. So, and at the end, they start to have like a webinar in which we have like a debate. We had a debate between some religious and leaders and local faith actors, and with other regular people who attended and participated in the webinar, so we can start to listen to the stereotypes and the information that they have, and we can check what's in a right way, what's not, so we can have a discussion between the local faith actors and the religious leaders, and between the other people who can like change their minds. So how we can impact, how we could impact on these behaviors, on the attitudes of the people, because like as Dr. Binar referred, the mistrust between the official authorities and between the people in some countries that caused like an escalated the problem and the pandemic implications on the community. So we need here like a bridge between the official authorities and the regular people to believe in and to follow what the information and the instructions of the government. So in the MENA region specifically, and I think in the most communities, but in the MENA regions and a country like Egypt, the people have a huge trust in religious leaders and local faith actors. So when the wars come, when there are like mediators between the official authorities and the people, so they can have like a more trust, so they can believe in what's going on, so they can take the precautionary measures to follow the instructions, to avoid social gathering and etc. Especially with some other leaders who like called for a religious gathering, and that it's fine to open the worship and we cannot close the worship during the pandemic times. But when we have like the head of the worship and religious institutions, so they can have some statements and they can support that it's not religiously wrong or false to close it. It's not wrong to have some restrictions during and to be responsive during in the time of crisis. So the people start to change, the people start to attitude in a different way and to be also a contributors in the improving the situations in general. Yeah, thank you.
Thank you so much, Monica. And there's some interesting comments in the chat as well, just related to, you know, I think you've touched on really how you convey clearly and with simple and appropriate messaging and words, how people can be connected. And I think there's also some interesting comments in the chat about how the pandemic affected not just health, but and how people responded in different ways from places of privilege or did not feel that responsibility, sort of that collective versus individual engagement. Our next speaker is Brother Ronaldo.
Yeah, thank you, Kirsten. I want to point out first that the restrictions on lockdown during the first year and this first and second year denied people's access to what is organic and what is cultural-based psychosocial support, which is the religious gatherings and the places of worship. This could have helped them deal with fear and confusion. It is part of our culture that we do not always look at it from a scientific point of view. As Filipinos, we always say, what is God saying in this experience? Is this a punishment from God? And that has always been part of the emotional confusion that people experience. But because we were not allowed access to religious gatherings, which they can learn from the pastors, from the priests, or they can learn from each other, that could have provided a sense of meaning and hope. And it also a venue to educate them and give them access to clear information. It became very confusing for many people. So we felt when the people couldn't go to the church, then the church went to the people. We decided that we visit communities, neighborhoods. We were in the community where we're already immersed and we were already trusted by the faith leaders. The communities we serve had been through a lot prior to COVID. I think we're familiar with the Philippines. We had a war, and prior to that, we had a major super typhoon, and then there was an earthquake, and then there was a volcanic eruption in Taal a month before COVID erupted. And there was a lot of confusion about whether this is a punishment from God, whether this is the end of the world. And the faith communities could have easily addressed that if we were only allowed to do so. However, we found ways to bring that message to community, to make sure that people's stories are being listened to. The most vulnerable were, of course, the children. So we focus on their mental health and psychosocial wellness. Since they lost their best psychosocial support, which is the school, they were not allowed to go to school. They lost their playmates. So for us, for example, we work with 1,200 children. We visited them in their families, in their neighborhoods, and provide a culture-based psychosocial support because of the lockdown. We try to train their mothers. We work mostly with women so that children can be enlightened. They gather around their mothers and they can give them the proper education and the proper way of dealing with the confusion. It's very challenging for many of us, but I agree that even until now, we do not really have an idea of what is the extent of the effect of the COVID on the mental health of the children. We do not have a study yet. We are afraid, of course, their education were affected. Their rights, we focus also on that because there was a rising incident of child abuse because they were contained in their family for 2 years and they had their parents with them. And there was a lot of emotional effect of that. We organized neighborhood bubbles. We trained local providers of psychological first aid. And at a certain point, we felt that we have brought the church to the communities when the communities couldn't go to the churches. Thank you very much.
Thank you, Brother Ronaldo. Excellent points. It's so interesting to hear the different perspectives from the different contexts, and just thinking of as a global pandemic, how much of the messaging was coming from, sort of an international health perspective, but not always being able to make the connections with what was happening in each country. And you mentioned all of the things that were going on in the Philippines at the time, and people having to make sense of that kind of external messaging while living in the challenges that you're describing. And I think that the local faith communities have been able to and can also improve on how there are bridging space between those two areas. Our final comments come from Professor Tudor. And again, welcome you back, Professor Tudor. Please, the floor is yours.
Thank you. During the pandemic, there were multiple psychosocial stresses, fear of infection, fear of death, compounded by various other, factors like loss of livelihoods, difficulty of accessing healthcare, and various other issues, people could not go out of their homes, so they were restricted. There was domestic violence within the families, partly because they have to kind of live with each other 24 hours a day and limited space, and also issues like stigma of being infected. People feared to associate with them. So there were multiple stresses during the pandemic, and often religion was the main source of assistance in these situations. Of course, psychosocial services in Sri Lanka are not well developed and also accessible to people in the periphery. So often people wanted to talk with religious actors, local faith actors about their problems. But as you know, during the pandemic, there were all kinds of restrictions on religious gatherings and congregations. So this, in some ways, restricted the capacity of local faith actors to interact with their followers. However, each religion actually devised very innovative ways of interacting with their followers, using, of course, phone calls, internet, email messaging, and WhatsApp and Zoom meetings. Some rituals were conducted using Zoom. And also where most people don't have access to internet, they use radio, television to do sermons and also do religious chanting. So even though there were all kinds of restrictions affecting rituals, negatively affecting rituals, they found ways to deal with it, and religions became very innovative and adaptive in this situation. So that is a very important point. And also I should mention that during the pandemic, early on, the state made cremation mandatory for all groups. And this, of course, negatively affected Muslims because they believe that their dead ones should be buried. So this created special difficulties for Muslims because they feel that, this is, this is against their religious faith. But one very effective intervention was most people from different religions basically came together and advocated to the state that there shouldn't be mandatory cremation because there's religious diversity and there's no conclusive evidence that burial actually contributes to the spread of the disease. So eventually the state decided to stop this mandatory mandatory cremation and open up the burial rights for Muslim people. So this is perhaps a very good example where different religions came together when they found that one religion was experiencing discrimination during the pandemic. So these are some positive examples during the pandemic.
Thank you, Professor Tudor. Excellent inputs again. And I'm just noticing the link between what you've just said and one of the comments in the chat. How do religious leaders come together to support each other, and how do religious leaders come together maybe to work together on how we're messaging. Also think that some of the comments in the chat have also pointed out that as much as the international community was speaking about this as a health pandemic and all of the messaging around the health behaviors, the guidance all relating to health, sometimes minimalized or overlooked some of the more pressing survival issues of livelihoods and how people navigated just being able to maintain a life, feeding, participating in the economics, being cut off from jobs. All of that contributed to stress as well as the fear of the health ramifications. So what's fascinating to me is the different contexts and the different examples of how faith actors have responded. Our final question has to do with allowing each speaker to provide some summary comments. Each speaker will have about 3 minutes. And the question is, what is the main takeaway? What is the lesson, opportunity, or highlight or recommendation that you would want to share from your own experience, your own engagement, or your own observations? What is something that you would like people to be thinking about? What is something that you would tell people who are in charge of making decisions about how we respond during a pandemic? Some of the things from your context that you think need to be considered. So we will have just some final questions here. I do request and invite you to put your questions in the Q&A box. I think there are some questions in the chat. Please put your questions in the Q&A, and Zainab will be helping me to identify the questions as well. So we'll give each speaker an opportunity to address this last question. And can we start with Brother Ronaldo?
Thank you. Sorry. Thank you, Kirsten. There are several lessons I would like to mention. One, of course, is the role of culture in managing or handling a pandemic. Like us in the Philippines, Filipinos are family-oriented and community-oriented, and surviving alone, locked and away from our clan, our relatives, seems very difficult. It seems even selfish for us. Many of us broke protocols in order to visit each other just to make sure that everyone is okay. It's because the isolation created unnecessary anxieties, especially since we were not allowed to visit them when they were sick, and we were not even allowed to visit them during their funerals and burial. And that was very, very hurting. More than the virus, the fact that many people died, many of our loved ones died, and we were not even there for them. That was more painful for many people rather than the actual effect of the virus itself. The second lesson that I learned is the value of historicity. Here in our country, we look at life as a continuum, and as faith communities, we help each other look at the pandemic as part of our faith experience, as a chapter in the salvation history of God. We ask people to write their experiences so that people in the future will know how we have survived and managed the pandemic. The third lesson I learned is the crucial role of women and youth in educating families and children. Unfortunately, at the time, the schools were closed and media was not so helpful in actually giving correct education. There was so much confusion between the scientific community, and there was a lot of fake news in social media. So we work with women, and the women became our educators in their own families and children. The value of faith, of course, as a resiliency and recovery factor. Resiliency is the ability to survive and bounce back from a disaster with your dignity and values intact. Some survive but sacrifice their dignity or their values along the way. But for us, because of the action of many faith communities and faith actors, we're able to survive together with our values and our faith, values intact and our faith stronger. My aha moment is the enlightenment that religions and faith traditions have so much to contribute to recovery, to development, and to peace building. We, as Catholics, we have yet to truly discover and unearth these contributions, which have always been set aside in favor of universal best practices and technical expertise from humanitarian experts. And now we became painfully made aware of how little these international experts know of the fragile and unseen elements that bind communities together, that brings healing to a community. And that's where local leaders and faith actors can actually contribute a lot. Thank you, Kirsten.
That's such an excellent point that you're making about the sort of the contradiction between universal best practices and the realities of what the specific ways that people are living in the context of this pandemic and in others. And I think what we're learning from this pandemic is, so you've answered the question really well in terms of what is the messaging, what do we want people to be thinking about this as we move forward in working on this and other things that are going to be coming our way. Dr. Binar, could I ask you to make comments to the same, your key messages and takeaways?
Yes, so for me, this has been a real eye-opener on just how damaging misinformation can be and how many lives it can cost, because we now have vaccines that are life-saving, that we know work, and are essentially the biggest cause of death from COVID is now lack of vaccination, because if you are unvaccinated, your mortality rate is significantly higher than someone who's vaccinated if you catch the virus. And so we continue to battle this infodemic. And as faith leaders and faith actors, you are in a very powerful position of having trust within your community and having a platform and being able to elevate those evidence-based, science-backed content and advice and information around vaccination, around social measures that will help to reduce the spread of the virus and effectively save lives. That's a very, very powerful position to be in. At the beginning of the pandemic, we didn't know very much about the virus. It was a brand new virus, and we kind of went along with what we knew based on other respiratory viruses. We know the virus is different to the flu, for example. The flu, you're more likely to contract if you are in close proximity with someone or if you touch surfaces where the flu virus is. COVID, on the other hand, is airborne. So this is why we know that the most effective measures we can now implement are wearing a mask, proper masks, so FFP2 and FFP3 or N95 masks. They reduce transmission significantly. We know that it's airborne, and so having good ventilation and open windows reduces transmission by up to 70%. And we also know that vaccines work. But it's really important that people who have a platform, who are trusted within their communities, help to elevate those messages, because at the end of the day, we all want this pandemic to go away. We want people to be safe, we want people to be able to get back to their lives, their livelihood, their communities, and enjoy being able to go to church, mosques, etc. But we have to do it in a way that's safe, and that's not going to be at the cost of people not just losing their lives, because some people will survive the virus but have ongoing chronic damage with issues like long COVID and chronic organ damage and in some cases disability, like we're seeing now. So that's my take-home message, is if you're going to get your information, please do so from accurate sources. And if you're in a position where you have influence within your community, please make sure the information that you're amplifying is evidence-based. And if you want to know who to get information like that from, please get in touch, and I will send some really fantastic and useful resources your way. Thank you.
Thank you, Dr. Binar. Again, really very specific and helpful recommendations. Professor Tudor, over to you. Have we lost Professor Tudor? We may have lost Professor Tudor. So Monica, can I invite you to make some comments?
Yeah, sure. So if I will start with the learning lessons, I have 3 main points. Using information technology to inform and empower people. Of course, as well, the local faith actors. Using technology was a part of the project as an empowering tool, so you will allow all people in an inclusive manner and provide opportunities to vulnerable people who live in far geographical zones to participate in your activities, and for the local faith actors to send their messages and reach their messages to them, regardless the geographical boundaries, regardless the any costs they cannot afford. Thus, all people can reach the information, publish materials online at any time, not restricted to the time frame of your project or initiatives, which encourages them to become more involved in social work and being more impactful. And the same for our initiative. So we have a training manual, including how the local faith actors can be responsive to COVID-19 pandemic with their comments, with their interactive exercises, and the outcomes of their discussions in our website. For our initiative, we have a website that includes all the materials, training manual, 2 guide papers, one of them related to hygiene measures and another to how to combat and counter social stigma during crisis time, and also some videos which include messages from the local faith actors to support for the psychological support of other people. And what's emotional here is that some of those actors have family members and relatives and friends who got COVID-19, who suffered from the same social problem, so they talk from their heart, so that their messages reach easily and more quickly, as well as a more recent focus in the collaborative work with the religious institutions. So here we insisting on the involvement of local faith actors and religious institutions or faith organizations in general with the policymakers, official authorities, and civil society. So the cooperation and collaborative work between all these actors together can result in a good and a really cure for the social problems. So the policymaking process and building the capacities as an influential and social actors. The last lesson I want to highlight here is the importance of dialogue initiatives to promote human solidarity and peaceful coexistence, providing techniques in this regard, such as how to design grassroots initiatives promoted by interreligious dialogue and mechanisms to counter negative social phenomena like social stigma, hate speech through counter-narrative campaigns. So the building capacity and provide a training and materials and methods and peer-to-peer education for the local faith actors is also one of the methods to have a more active and more impactful actors in your community and more stronger faith organizations. So when we come to the change and impact, which is like the main highlights we want to refer here as a real impact on the ground and even on the participants themselves, on the local faith actors, their behavioral change. The beneficiaries engage in more social work through implementing the initiatives and keep following up. So from a trained 19 faith workers, we have 5,000 indirect beneficiaries from their initiative and their work. So also improve personal hygiene and more commitment at that time to the precautionary measures, pursue psychological support, sympathy with socially stigmatized people groups during COVID-19, countering any type of hate speech, and reading their knowledge, the valid and the credible sources to get the information related to COVID-19. So when they go later, like at that time the workshop were closed, but later when it's open, they start to calling for a well and evidence-based information the people should rely on, not any information that's published. Also learning the mechanism and conditions to discover rumors, distinguish between right and false information. So it's not only related to the COVID-19 when we see the impact, but also with any other information that later may face the community. And later having the skill on designing and implementing initiatives that related to step and structure. So after like a post-COVID-19 time, so we can see how they can be responsive, how they can deal with the effects and implications at that time. So recommendations at the end, the importance of inclusion and emphasizing on advancing the support for spaces that encourage dialogue between diverse groups of men and women and different backgrounds of ethnicities, religions, tribes, and cultures. The cooperation between policymakers and local faith actors by involving them in policymaking process. And lastly, I would like to share the website with you on the chat box, so you can check all the materials, and if you can use, like, feel free to use them in any formal, in informal education and freely cost. Thank you so much.
Thank you so much, Monica. And Professor Tudor, I see you're back. Would you like to make some comments on this last question, the key messaging, the key takeaway or learning that you would want to share with others?
Thank you very much. Actually, in Sri Lanka, we learned a lot of very good lessons about the role of religion during the pandemic. The very first one is, it's when public health officials work in collaboration, when they team up with religious practitioners, often their messages get accepted by people and they behave in a positive manner. I can give a very good example in Eastern Sri Lanka. During the early period of the pandemic, there was a great deal of vaccine hesitancy. People were scared to take vaccine, partly because of misinformation about vaccines in social media and other media. And in some examples, health workers collaborated with Maulavis and other Christian priests and Hindu priests in promoting their message among the people. And that actually increased the acceptance of vaccine a great deal. Initially, it was as low as 10%, but it rose right up to about 70% due to the intervention of collaborative intervention between health professionals and religious faith actors. So that is a good example of application of religion during the pandemic. A second very useful lesson we learned is how quickly religions and faith actors can raise support, raise funding for the affected people. They came forward even before state agencies provided relief services, and they collected donations from large number of people, not only from within their religion, but even from outside. And also one very positive feature of this intervention was that in most relief services carried out by faith actors, their services were not limited to the followers of their own religion. They make a deliberate effort to actually provide services to disadvantaged people in other communities as well. So this was a very useful and effective thing. And this relates to the third lesson learned, and that has to do with peace building. The role faith actors can play in peace building during the pandemic and during other periods of tension by working together, and also trying to promote healing and spiritual guidance to people from the local community, and also try to educate them about especially misinformation and why they should not trust them. So faith, especially there was a lot of interfaith activity in Sri Lanka during the pandemic, even though despite the restrictions on congregations and so on, there were quite a bit of interfaith activity. So it shows the potential of religion in promoting peace and harmony, particularly in a conflict and disaster affected country like Sri Lanka. And finally, there is also this I think I already referred to the innovative and adaptive nature of religion. Religions adapt to the situation. They where they can't practice conventional rituals, they found Zoom meetings, continuing at least some of the rituals through Zoom, especially, in situations like death, where funeral services could not be delivered at homes of the affected people. They invented certain ways of providing these services via Zoom and via WhatsApp in some situations. So this, I think, is an important point that we should highlight. That some people tend to think that religions are very conservative and they don't change their behavior quickly. But we found that this is not the case. I think these are some important lessons we learned during the pandemic.
Thank you so much. So it's my job to be aware of the time, and I'm going to adapt one of the questions. I think we just have time for one of the questions. I'm going to adapt it and combine some things, because we want to leave a few minutes at the end for you to provide suggestions to us on what you're interested in hearing about in future webinars. So we have a question coming from Nagaland in Sri Lanka. So building on the innovations and learnings, what do you expect to be permanent adaptations to how you work and how you engage with communities? And what kind of support will you need to, would you like to have to do those adaptations? So that could be conveying evidence-based messages, use of local media, dealing with resistant behaviors within the community from other faith actors, any of those things. What are some of the things that you want to do, that you want to begin to do permanently, and what kind of support would you need to do that? What kind of support would you be looking for to be able to be successful? So let me just give each speaker a moment to comment on that. Would anyone like to start?
Can I start?
Sure.
Yes. In regard to the support, I think, it's very important that after or at the end of the pandemic, there has to be a kind of open discussion about lessons learned among different religions. So maybe some kind of workshops to review what they did well and what they didn't do so well. I think it's important. So there has to be a final kind of assessment, wrap up about what happened during the pandemic, what things they did well, and what things they didn't do well is important. And also, I think there's definite need to build on the peacemaking or the role of faith actors as local, peace builders. And there were positive lessons, but I think we should not see it as the end of the journey, because conflicts are very common in all the countries. So we had to find ways of continuing these activities and especially building on positive lessons learned during the pandemic.
May I, Kirsten?
Absolutely.
Yeah, I may not use the term permanent, but maybe more long-term or sustainable. I can cite two. One is pandemic management or any other management especially in our context, should include representative from the religions and the faith community. Unfortunately, in our country, the interagency task force, the faith communities were not even represented, and both in the national and in the local level, even if they have a significant contribution in the management of the pandemic. It was only this year that we were allowed to sit in interagency task forces to help guide in the recovery and in the transition. But I feel it should be something that should be more long-term and sustainable in terms of the lessons we learn from this. I'm looking now at the other thing that I feel should be given attention is the fact that mental health and psychosocial support has been very weak during the management of this pandemic, at least in our country. The focus were more on the protocols, the mask, the hand washing, and also in terms of food security, but there was very little that was invested on mental health and psychosocial support. And that should improve in the next, I'm not hoping something like this will happen again, but hopefully in further down the road, we should be able to make sure that mental health and psychosocial support should be given also emphasis. If there's a capacity building kind of support that we need, at least from our experience, it's always the convergence of science and religion. How can these two, agree and come up with a common message? For a long time, many of our Muslim communities did not want to be vaccinated, thinking that it could be haram or against their faith. And there was little that was given by faith leaders in terms of how scientific and evidence-based studies can actually be supported by their faith teachings and their faith traditions. That's something that's very weak in our country, the convergence of faith and science, and hopefully that can be improved after the pandemic.
Thank you so much. And I am aware that we are at time, and my apologies to Dr. Binar and Monica, although I think in some of your previous comments and responses in the Q&A box, you've touched on some of these points as well. What I'd like to do now is just to thank the speakers for their incredible insights and just the richness of the tapestry of the different places and spaces that you were operating in, the different dynamics, the different experiences of COVID. And I would like to invite you all to provide some input to us in the survey. The link to the survey has been in the chat box. We also invite you to put in the chat box any, in addition to the survey, any ideas that you have for other topics, but the survey itself will give us a good indication of that. We do appreciate all of your feedback and suggestions. This is a platform for us to hear of a variety of different voices and to talk about the different topics that are affecting us that that really emphasize the voice, the agency, and the impact of local faith actors as frontline agents and those who are actually experiencing and living with something like the COVID pandemic within very specific contexts. So I have been really inspired by each of the speakers on this webinar. I am sure the rest of you have as well. And with that, and with 1 minute over the event, we thank you for your participation and thank you to all of the speakers for your thoughtful insights and comments.
Thank you, Kirsten. Thank you all.
Thank you, everyone.
Thanks, everyone.